So let's get started. You've already heard from Deirdre Costigan. She's our Unison National Officer for Disability Equality. And she's going to kick us off by explaining what disability leave is all about. Over to you, Deirdre.
Great. Thank you, Liz. Elizabeth, rather. I'm always saying the wrong name. My name is Deirdre Costigan, as Elizabeth was saying, and I work for Unison. I'm the National Officer for Disability Equality. And I'm going to kick off this evening's session by really just explaining, I guess, as a starter, what we mean by disability leave and how we go about negotiating for it in the workplace. But like I say, and what we also want to hear from this evening is from you guys and what your experience has been in the workplace. So I'm just going to try and share my screen now. I'm hoping this works. Let's just check, and I'll hopefully, I've got my colleague, Anne, who's also on the call, and hopefully she can give me the thumbs up if that's working. And it's up on screen. It is up on screen. Brilliant. So, like I say, I'm going to talk a bit about negotiating disability leave this evening. So let's start with why disability leave should matter to my branch. So why are we even asking you to focus on this issue, particularly in our year of disabled workers, which hopefully you all know about? So 1 in 5 workers are disabled. That's a huge amount of the working age population. And for Unison, we estimate that about 200,000 of our members are disabled. So that's, you know, of our 1.3 million members, that's a really, really big number of people who we need to make sure that we are representing and negotiating for in the workplace. And I think, you know, some branches perhaps think, you know, maybe there isn't any disabled members in my branch. We have 200,000 members. There's bound to be some in your branch. You definitely have disabled members. There is often a case that some disabled workers perhaps haven't told the branch or their employer that they're disabled because of the discrimination they face. And negotiating for disability leave policies can help them to be more open about being a disabled person because they feel valued by the branch and they feel valued by the employer. So it's an important step towards making our members understand the value that we put on them and their experience in the workplace. But there are other reasons why disability leave is important to our branches. And one is, many of you will be reps and you'll spend a lot of your time representing individual members. I used to do it myself when I was a rep. And a lot of the time I spent with disabled members was around sickness absence procedures and negotiating reasonable adjustments. And it was a, you know, individual by individual discussion. It would involve, you know, lots of managers and HR and all of that. And it took a lot of time. Sickness absence meetings took a lot of time. And that's time that if you had a policy agreed on disability leave, you could cut down on. And you could use that steward time to look at other areas and other priorities for the branch. So it's a win for the branch to be able to negotiate a disability leave policy. It can also address some of the grey areas in the law, and I'll come on in a moment to some of the issues around the law where we have to do some bargaining and negotiating rather than being able to say, look, it's written down in the law, you've got to do it. Having a policy can stop that argument and can mean that you can just point to the policy and say, look, we've agreed this in the policy, let's just do it. And of course, a disability leave policy can be a great recruitment opportunity. It can attract new members to join Unison because they've seen that we're able to deliver for disabled workers. So, of course, it's not just about what the branch wants. We also have to think about what's the driver for employers. How can we get them to see that this is a positive for them as well? Well, for employers, if we can agree a disability leave policy, they spend less time on sickness management. I said about, all of these meetings that you often have around the sickness absence procedure. You have high paid HR and senior management staff involved in some of these meetings. Their time could be spent on actually running the organisation if there was a disability leave policy. So apologies for that sound glitch there. There's also significantly less risk of employment tribunal if an employer has a policy, because then when the court looks at an individual experience in an employer, the employer is able to say, well, look, we had this policy and we acted reasonably. So they're able to make the case much better in employment tribunal. So they'll have much more assurance that, for example, rogue managers won't be able to make decisions in individual cases that might see them end up in employment tribunal. They'll know that their policy works and will make sure that disabled people are treated fairly in the organisation. It can also help increase productivity, reduce staff turnover and recruitment costs, and it stops that loss of talent to an organisation and having to recruit new workers to replace, great disabled workers who really shouldn't be lost from the workplace. And it can improve morale across the whole organisation, because again, disabled workers feel valued and feel that the organisation understands their experience and the way they live their working lives. So we know why the branch should be looking at it, and we know what's in it for the employer. But what actually is disability leave? I think a lot of people, we did a survey of our members a couple of years ago, and about 2/3 of our members had never heard of disability leave. This is disabled members. They had never heard of disability leave. They didn't know what it was. So disability leave is a type of reasonable adjustment. People will have heard of reasonable adjustments before, I hope. It could include things like changes to your start times and your finish times. It could include home working. It could include speech to text software. It could include lots of other changes to your job. Disability leave is one of those adjustments. So it comes under that banner of reasonable adjustments. But it's a very important reasonable adjustment, and it can make a big difference to disabled people's working lives. And it can be defined as time off from work for a reason related to someone's disability. So time off from work related to your disability. And it includes periods of treatment, rehabilitation and assessment. And I'll go through in a moment what that actually means in practice and what examples might be of that. It is different to sick leave, and in many cases, the worker is not actually sick. So you don't need to be sick to be on disability leave. It's about being disabled, not about being sick. And they're two different things. It may or may not be pre-planned. So you can have disability leave that you've planned, you knew it was going to happen and you've agreed it with your manager in advance, or you can have disability leave that you suddenly have to take on the day or the day before. It can include short or longer periods of leave, and it's crucial to tell employers that not all disabled workers will need it. Sometimes employers think, oh gosh, this means all my disabled workers are going to be off on disability leave. For many disabled workers, they may never ever need disability leave. But for others, it's so important, and it can ensure that they can stay in their job and continue to contribute to their employer. So what does the law actually say about disability leave? So the Equality Act 2010 outlines the right to reasonable adjustments. And as I say, I hope that most people on the call will know and understand what reasonable adjustments are. And if you don't, we've got some great resources on the Unison website and a brilliant guide called Proving Disability and Reasonable Adjustments that you can have a look at. And that explains in detail about the right to reasonable adjustments. But the Equality Act makes clear that disabled workers are entitled to more favourable treatment to break down the barriers that they face. And that more favourable treatment is in the form of reasonable adjustments. So where does disability leave come in? Disability leave is mentioned as an example of a reasonable adjustment in the Code of Practice written by the Equality and Human Rights Commission that sits underneath the Equality Act. So the Equality Act outlines the law about reasonable adjustments. And then underneath that, the Code of Practice gives disability leave as one of the examples. And it's important to say to employers, the Equality Act doesn't go into detail about the different examples. It's the Code of Practice that goes into the detail. So if they say, well, it's not actually written into the Equality Act, that doesn't matter. It's in the Code of Practice, and case law has also established disability leave. So there are cases where disability leave has been found to have been required. And that's as good as it been written into the Equality Act. It is important to establish that the member is a disabled person. So disability leave is only for people who are disabled. Sometimes people say, oh, if I've broken my leg, am I entitled to disability leave? No, it is for people who are disabled, and the law explains what the definition of a person covered by the Equality Act is. You are a disabled person under the Equality Act. Just as a refresher, if you have a physical or mental impairment, if it is long-term, which means it has lasted or is likely to last 12 months or more, and it has a substantial, which means more than trivial, adverse effect on your ability to carry out day-to-day activities. So if you fit that definition, then you are a disabled person under the Equality Act. You are entitled to reasonable adjustments, and disability leave is one of the reasonable adjustments you may well be entitled to. However, it is a bargaining challenge because there are some grey areas of the law. And that's where you come in as our stewards on the ground in branches, able to do that bargaining with employers and get a policy agreed so that you don't have to spend time arguing about the detail of the law. So I said I'd give you some examples of what disability leave looks like. So disability leave could cover any of these and more. They're all just examples, and it depends on the individual case. Everyone is different, and every disabled person experiences the challenges of the workplace differently. And that needs to be taken into account, but with reasonable adjustments more generally and with disability leave. But it could cover rehabilitation training for a newly disabled worker and perhaps learning to manage a new condition. It could cover hospital or GP appointments. It could cover cancer treatment and rehabilitation. In fact, the example given in the Code of Practice is of somebody who has cancer and needs rehabilitation and treatment. So that's actually the example given in the Code of Practice. But it can also include assessments for conditions such as dyslexia, for example. And it can include counselling for a mental health problem. Now, a really important area for disability leave is that you are also entitled to disability leave if you are waiting for your employer to make reasonable adjustments. Now, that's a big one and one that sometimes we forget, but it's important to make sure that's written into your policy locally. We found that many of our members wait a really long time to have reasonable adjustments put in place. And our survey in 2019 found a quarter of disabled members responding waited for a year or more to have their reasonable adjustments put in place. Now, if we had agreements with those employers that people would have disability leave while they waited that year, you can be sure they wouldn't be waiting a year. Those reasonable adjustments would be put in much more quickly. So that's an important one to remember. The other one to remember is periods of sickness related to disability. So it can also cover disability related sick leave. Now, this is an area of bargaining. There are some case law examples where the courts have found that disability leave, the sickness should have been counted as disability leave and not as sickness absence. But it depends very much on the individual case. And it's an area that we spend lots of time arguing with employers and negotiating with employers. And again, this is where having an agreed policy can really, really help. It is important, as I said, to remember the difference between disability leave and sick leave. They are different things, and disability leave includes periods where the worker is not sick. And so it's important to have your sickness absence policy separate completely to your disability leave policy. They are two different things. And as I said, good practice is to include disability related sickness as disability leave in your policy. We've also, though, I think just need to mention that changes to sickness absence triggers should be considered as a reasonable adjustment, and that can be in the sickness absence procedure, so that those triggers could be changed if it was disability related sickness. But what we want is sickness related to disability to be kind of taken out of the triggers altogether and recorded separately. But like I say, that's sometimes an area where you get pushback from management, and that's where a policy can help out. So what are the ingredients for a good disability leave policy? And I'm hoping some of you guys later on in this discussion will come back to us with some of your own ideas of what perhaps you've negotiated locally or what you think is important to focus on. But a core thing that Unison is saying is that disability leave should be paid. It seems really obvious, doesn't it? But some employers think that disability leave doesn't need to be paid, that you can take unpaid leave. Now, it needs to be paid leave, and that's core. That's the whole point of it. It has to be paid. Disability leave should be recorded separately from sick leave. Like I say, it's a different thing. It should also be removed from any trigger calculations in capability procedures. So disability leave shouldn't be counted. Capability procedures will look at sickness absence, not at disability leave. There should be a policy both for planned and unplanned disability leave. Some employers try to say our policy just covers planned leave and you need to have asked for it in advance. But Unison says that it should be planned and unplanned disability leave, and there's no grounding in law for them to be able to argue that case. So we need to push back to them on that. Another important area is that there should be no maximum duration of disability leave. Some employers try to say, we'll offer disability leave, but it's a maximum of 5 days. Well, that doesn't work under the law, because the law is about what is reasonable in the particular case. And for one person, actually just 2 hours of disability leave a year to go to a hospital appointment, that might be reasonable. But for another person, 10 days might be reasonable, or 15 days might be reasonable. There's no one size fits all. And we need to make that clear to management, and we need to make sure we try and include that in a good policy. However, I know sometimes you've got to make compromises when you're a Unison negotiator. So we don't always get what we want in the policy. But the point of tonight, I guess, is to talk about any learning people have from what they've done locally and how they've managed to get the best ingredients in their policy. And of course, like all union negotiating, regular review is really important. So the policies we agree now, you need to make sure they're reviewed regularly to make sure any changes are taken into account, any changes in the workplace, or just any changes to how we understand reasonable adjustments. So I know from when I used to negotiate with my employer locally, we often started off with the employer saying, we don't see the reason for this, and we're already doing stuff on this, so we don't see a need to reopen the discussion. So it's important to think about how you would rebut some of the employer arguments. One of the arguments that they may use is that they'll say, oh, this disability leave scheme, it's open to abuse. People will be asking for disability leave who don't need it or aren't entitled to it. First of all, like I say, not all disabled workers will ever need disability leave. So it's important to stress that with the employer, but also to say to them that a scheme based on Unison's model policy, and we have a model policy, that will prevent abuse, and it will make sure everyone is treated in a consistent manner that is in line with the law and with the Equality Act. Other employers, and not very good employers in my view, try to argue that having a disability leave policy is giving preferential treatment to disabled workers. Now, this one is kind of my favorite and my least favorite all at the same time, because it's ridiculous. The law requires disabled people to be treated more favorably where this is a reasonable adjustment. So what they're saying is the opposite to the law. Actually, you are required to treat disabled people more favorably. So to claim that somehow they're discriminating against non-disabled people is completely ridiculous. And anytime we hear that argument, we need to go straight back to them and explain the law to them. Now, another area employers come back on is they sometimes say, we've already got a special leave policy, so we don't need a disability leave policy. Special leave is discretionary. It's something that the employer can decide to give you or decide not, depending on the circumstances. Disability leave is a reasonable adjustment and it's a right under the Equality Act. It's completely different. And we're very clear that a special leave policy is not good enough. And we need to go back to those employers and say that they need a disability leave policy to make sure they're in line with the Equality Act. Other employers say that they already record sickness, disability-related sickness separately, and that's a great start. You know, that is great, and we should give them, you know, the kudos for doing that. And I hope that a lot of your employers are already doing that. But we also need to ensure that people are entitled to paid time off when they're not sick, and that comes under disability leave. So it's important to make that additional point to them. And of course, there are employers who say we've already got a disability leave policy, so why do we need to talk to you? Now, what we say there is, are we sure that that disability leave policy is good enough? Is it compliant with Unison's model policy? And in particular, some of the ingredients I spoke about earlier. For example, is there a maximum number of days that they're allowing people off? If that's the case, we'd want to bring them back to the negotiating table there and explain to them that there is no one size fits all and everybody is different. But so there's some of the ideas that you can go back to management with if they're not too willing to sit down and talk to you about this. So I'll just finish then, Chair, with some top tips really on how I would start on negotiating disability leave with the employer. But I'm hoping that you guys have lots of other ideas. First of all, it's important to get disabled members in the branch on board, whether that's doing a survey or organise a meeting. Either way, try and get the disabled members in the branch on board and get them involved in the negotiation. It'll also give you some evidence to go to management. If you can say, we've done a survey and people are saying they're forced to take sick leave, then they're ending up being on a capability, and you know it's not good for you as an employer, and it's not good for the staff. Organise a meeting, get people to tell their personal stories. So getting your members on board is really key. Then build the business case. Why is it good for the workforce and for the employer? And we've got lots of data in our bargaining guide on this, and I'll talk about that just before I finish. Then use the model policy to share with the employer. And there's also a section that explains what disability leave is and answers some of employers' questions that you can also share with the employer. And as I say, push back on maximum leave periods. One size doesn't fit all, so try not to allow them to agree a set number of days for disability leave. So I'll just finish there. That was a bit of a whistle-stop tour, but I'm hoping that you will have lots more to say once we've heard from Toby. But I will just let you know, I'm going to unshare screen now. Hopefully that works, yeah. And hopefully you can then see this. My camera's slightly backwards. I'm not quite sure if you can read what it says, but this is our disability leave bargaining guide, and you can download this on our website on the disabled members page. It's also on the online catalogue. We'll have lots of copies of this at National Delegate Conference if you're there in June. It's a great document, and disabled members on our National Disabled Members Committee helped to write it. It includes lots of the tips and ideas that I've just given you this evening. And as I say, there's a model policy in the back. So you can literally take that policy, give it to your employer, and suggest to them that they agree that in order to make a really key difference to disabled people's lives in your branch. Okay, thank you, Chair. I think I'm done. I'll pass back to you.
Well, thank you very much, Deirdre. That was astounding. For a whistle-stop tour, you really covered the main things there, the main points. One of them that I always get asked when I was assistant branch secretary was, can we force an employer to instigate it to say? Anyway, enough from me, because everybody who knows me knows that I could keep talking till the sun goes down about disability. We are ready to welcome one of our speakers now. So I do want to welcome Toby Morrison. Toby is a member of the National Disabled Members Committee. He's also a community branch activist in Greater London. He's going to tell us about his experience raising disability leave with his employer. So over to you, Toby, and I'll turn my mic off because I think I'm the one with the...
Well, thank you very much, Elizabeth. And so, as well as being a shop steward at my organisation within the charity sector in Greater London, I'm also my branch's disabled members officer, and as well, I'm one of the regional Greater London regional reps on National Disabled Members Committee. Now, with disability leave, Deirdre referred to grey areas in the law. Now, particularly in the charity sector has one of the highest proportion of disabled members in the country, and disability leave is quite pertinent to that fact. Excuse me. So Deirdre was referring to sickness absence issues, and that is to do with something that a lot of union activists dislike. I'm not going to say that they hate it, but they dislike it very strongly, and that is something called the Bradford factor. And essentially, that is a totaling up of points that a person accrues, and if they have one day on, one day off, one day on, one day off, instead of several consecutive days off, they accrue more points, and employers unfortunately use those points against a lot of disabled members to effectively discipline them for being off for reasons to do with their disability. And that's not right in this day and age. And I'm a huge advocate for disability leave. I certainly think that it's something that we need to work towards, not just in the charity sector, but every sector across the workforce. My experience of negotiating disability leave in practice is limited. However, I am in the early stages of negotiating with my employer as a result of a member's issue that has come to light. And in essence, they've exasperated their sickness absence allowance, and in effect are now being penalised for not being in work as often as they need, as the employer thinks they need to be because of treatment issues and such. But anyway, with disability leave, there is a very grey area that that needs to be sort of addressed when you're bargaining with an employer. If your employer is a disability confident employer, the disability confident scheme is not legally enforceable in terms of an employment tribunal. The disability confidence scheme is a watermark. It's a mark to say that that your employer is supposedly a leader in disability disability rights and promoting the support for disabled workers. However, it can be a good bargaining tool when talking about a new disability leave policy. For example, you may be in negotiations around a new disability leave policy, and if your employer is disability confident, you may be in a position as an activist to say, well, in order to maintain our position as a disability confident employer and a leader in the field of supporting disabled workers, it would be appropriate to have a disability leave policy. And the disability confidence schemes, as far as I'm aware, actually look at employers who have a disability confidence scheme with a disability leave policy very favorably. And there are 3 levels. I can't remember the exact wording, but essentially, if you want to put it this way, bronze, silver, and gold. So, you know, the bronze being the most basic level, showing that that an employer does enough to support disabled workers. Silver, they do a bit more, and they're actually quite proactive in championing disability rights outside of their own workplace. And then gold, you know, that they are really championing disabled workers. And my hope is that one day that a higher proportion of employers meet that so-called gold standard, and that we have more employers that actually recognize disability leave as a necessity, not a luxury for disabled workers, and that there is a better understanding of that being a reasonable adjustment, and that us as activists are listened to, and that employers are reasonable in the way in which that they bargain with us. I think the three top tips that I would have for anyone wanting to negotiate a new disability leave policy is make sure you stand your ground and know the code of practice. Secondly, be open to compromise, but not so much compromise that you end up not developing the right support for disabled members. And thirdly, make sure that when the disability leave policy is in place, before it's approved by the board of trustees or whoever is overseeing your organization, that you run it past your members. You make sure that your members are at the heart of what you negotiate, because at the end of the day, we are a member-led union, and we are an organizing union. We do a bit of representation as well, as I'm sure you probably all know, just a little bit, you know, but it's important to make sure that what you're putting forward to the employer is a true representation of the views of your members, and particularly your disabled members. So yeah, if I think of anything else, or if there's anything in the Q&A that I need to answer, I will try my best to come up with some more helpful information. But otherwise, thank you for listening.
I've been muted. I've been muted. Well, I mean, many people would want to mute me. I have to say, I don't take it offensively. So we don't have Joanna, or who are we replacing Joanna?
No, hi, Elizabeth. We're going straight into opening to the floor now. Yeah. Oh, I think we might have lost Elizabeth again. We're having lots of fun today, aren't we? Anyway, it looks like we've lost Elizabeth again. So what we're going to do, she is on a train. She's been absolutely amazing. She's had 2 trains cancelled, but she still decided to try and take the meeting on the train. But what we're going to do is, and we're now going to open to the floor. And I know there's 3 hands up already. There's also some questions in the chat. I'll just quickly, there is a quick question in the chat from Stuart Estrella Pinto. Is it disability leave if the employer insists the time off has to be worked back? The short answer to that is no, because that's the same as not paying you for it, isn't it? If you have to work it back, then you're not being paid for it. So I would go excuse me, go straight back to that employer and say, this isn't disability leave, this isn't in line with the Equality Act. It's not paid time off if you're having to work it back. But thanks for that, Stuart, because I think that's an important point to make. Okay, I've got 1, 2, 3, 4, 5 people with their hands up now. So I'm going to call, I've got Tracy, Libya, Rod, Shona and Jackie. I'm going to call you all because we've got enough time, but if you can try and keep your comments short and succinct. So if there's others that want to speak, we can bring them in as well. And I'm going to click a button that'll allow you to talk. So let's see how it works. So Tracy. Have you got something coming up saying? Ask you to unmute, Tracy. Yeah.
I work from home and I work in the office. They've been brilliant at providing me a chair and a proper desk and everything at home, but not in the office. Do I need to ask him for something in the office? I'm not in there very often.
Right. Thanks, Tracy. And I'm going to hand back to Elizabeth in a second. But before I do, I think I'll just answer that and say, that would be about reasonable adjustments rather than about disability leave. So certainly, go and speak to your rep about that because we've done a lot of work on people getting their reasonable adjustments duplicated at home during COVID. It's, certainly something the employer should be doing. So do please speak to your rep about that. But we're going to try and focus on disability leave specifically this evening rather than on the broader category of reasonable adjustments. So I'll just hand back now to Elizabeth. I hope she's back with us. And if we can bring Toby back on the screen as well, Anne, so we can both jump in.
I am indeed. And the thing is, I keep talking to you, is that you're losing me till the very last minute. So please, we're going to try and attempt to answer your questions if we can. And then we've got Deirdre here to help us if there's anything that certainly from a legislative background that we can help you with. But, what I'd really like to hear from is anyone who's negotiated a disability leave agreement with their employer. What worked for you? What are the do's and don'ts that you'd say to anyone else? Use the hands up icon to speak or ask a question just so that we can organise it. Remember, we have interpreters here, and that's to make things easier and more accessible for people. So it's not just a colourful extra. It's because some people actually need that for their full communication. So please bear that in mind. Speak clearly if you can, and slowly, so that the interpreter can do the best job possible to help that to get to people. And you can put your comment or question in the Q&A. Feel free to type that in.
Okay. I don't know if we're losing Elizabeth again there. So I'm going to call the next speaker, and I'm going to call a few now in a row. And if people can be brief,
and then we'll unmute you so that you can speak. So I open.
Okay. So sorry, Elizabeth, I've just muted you. I've just muted you, Elizabeth, because you're coming in and out. So I think the next speaker is Libya, and I'm going to call a few in a row. So okay, Libya, I've had to promote you to panelist. All right, Libya, can you hear us? All right, if not, I'm going to allow Rod to talk. Rod, can you hear us? Yeah, go ahead, Rod.
Yes, I'm from Oxford University branch. The thing that has pointed out to us that we probably need to negotiate one of these policies is that we've realised that 50% of our casework involves members with a disability. So that has really highlighted for us that we need to go down this route. So this has been very useful this evening. Thank you.
Hello, can you hear me?
Yes, we can, Libya. Go for it.
I'm so sorry because I could hear you, but you couldn't hear me. Right, thank you, Deirdre. This is my first time here. I'm calling from the London Borough of Hackney. Yes, this is my first time here. Thank you for training through your presentation. Just a quick question. Are you open to sharing those slides with us? Because I was trying to listen to you and ferociously write everything at the same time.
Yeah, we'll send them out to everybody afterwards who's registered.
you.
Libby. Yeah,
Thank
yeah.
you. Yeah, we do not have, in the London Borough of Hackney, we currently do not have a disability leave policy. This is something that I know Unison at Hackney and myself, because I've been personally impacted and I've heard a variety of stories that we're keen to implement. It is going to be a huge challenge. Some of the experiences of our members, of people that work here, is they struggle to get annual leave, bereavement leave, all sorts of leave. So getting disability leave is trying to negotiate that is going to be an uphill struggle. Some people are saying, some of the people have shared their stories and they said that they've literally done everything to try and manage their sickness, but they keep being pulled up on various procedures and that exacerbates their sickness. So what management are trying to do is manage that sickness, but by putting this procedure in place, i.e. a level 1, a level 2, they're making the sickness worse.
Great. Thanks for that, Libya. That's really, really useful to get your experience there in Hackney. I'm just going to, Toby, take some more speakers because we're going to, Shona. Yeah, can you hear us, Shona?
Hi, Deirdre and everybody. I'm Shona Gregg from Cambridge and Peterborough Unison branch, and I work in Cambridge. My question really is around the long COVID situation, because we are experiencing people now going through normal sickness procedures, but I can't find anything on NHS employers that says that is the case and that's what should be happening. So it'd be really useful if there was some information we could have where we could argue back against the employer.
Great. Thanks, Shona. We've actually got a guide to supporting members with long COVID, and it also includes, you know, how to argue that your member is a disabled worker.
Okay.
I'll get Anne to put that in the chat so that people can have a look at that.
I can look for that as well. That's great.
Brilliant.
Thank you. Thank you.
Okay, and then I think I've got Jackie Lewis, I think is next. Jackie.
Hiya. Hopefully, yes, can you hear me okay? Yeah. Right, the last colleague was is touching on something I wanted to raise, and this is kind of a question, but I think the pronouncement by the Equality and Human Rights Commission on long COVID, which then I'm putting this very briefly, so, and I know, Deirdre, you know what I'm talking about, so you might need to add a bit of explanation, but that appalling pronouncement by them has caused a lot of confusion, and I know, because I saw it, that Unison published an article rebutting it. I just wanted to say that I think this will carry on being an issue. So I think anything that Unison can do there's a connection, isn't it? We're talking about people having adjustments, but also, if necessary, a leave which doesn't count towards sickness or capability or anything if they've not had those adjustments. So as you're nodding at me, Deirdre, and I can see that, and I know that you're quoted directly in that article, and it's just what this is about. This, of course, is not the only thing the HRC has recently pronounced on wrongly. There's lots of arguments about them at the moment. Anyway, I think one of the things probably is just to emphasise the importance of the statutory code of practice, to re-emphasise that. Yeah.
Great. Thanks, Jackie. You're coming in and out a little bit at the end there, but I think we just about caught that. And absolutely, we'll try and put some more links in the chat to what we're doing around long COVID, and particularly around that Equality and Human Rights Commission statement, where Christina McAnee has written a letter back telling them that they're wrong. I've got Lucille next. Lucille.
Hi, can you hear me okay?
Yep.
Hiya. So it's just a quick question. Deirdre, I know you touched on before, and it's really important about one size doesn't fit all. And that's quite right, because we're all human beings, we're all diverse, so we've all got different needs and things. So somebody could just have a requirement for 2 days, whereas somebody else could have a requirement for, say, 2 weeks. So is it easier then when you're negotiating to negotiate for a set amount of time? Because then the employer could say, okay, well, you've had your 2 days, you're not getting any more time. for example? Would it be easier to negotiate, say, for example, a week or 2 weeks, so they have that chunk of time?
What we normally advise is that you don't agree a maximum period, because some people may need longer than that, and
Right.
everyone's impairment and the barriers that they face are different.
So it could go even longer than for
yeah.
15 days, for example, right?
Yeah, yeah,
Thank you.
absolutely. I'm going to take 2 more, I think, because I think that we've just got time for that, and then we'll bring in Toby, and hopefully we can get Elizabeth back for the end. So I've got that was Shan, I think. I've got Bev. Go ahead, Bev. Can you hear us? Is Bev still there? Yeah, Bev, can you hear us? Okay, I'll try Michael if Bev is not there. Michael, can you hear us?
Hi, can you hear me?
Oh yeah, go ahead. Yeah.
Hi, Deirdre. Sorry about that.
Hold on, guys. Just Bev, come in first, then Michael. Yeah.
Yeah, sorry. Hi. Yeah, I work for a supposedly disability confident employer. However, I've just experienced a terrible time where I've just had to take 6 months off from getting PTSD whilst at work, and whilst trying to get a sick, because I do fall under the disability because I already suffer from depression and anxiety. I find that the policies that are in place for the disability side of things are very physical orientated, and I think that's something that people are much more understanding of when it comes to policy, but when it comes to the mental health, because of the lack of education, the lack of understanding still, that the policies are very, very, very physical orientated. So the disability sort of like, disability, what we're discussing, sorry, I'm just a bit nervous, sorry. It doesn't seem, it feels like it's very, very millions of miles away from the physical side. And part of me feels like it needs to be separated. So physical health disability and mental health disability I feel there is a complete, miles away basically. And I just feel like there should be a separate kind of, policies for each one. So there is more understanding.
Some good points there about employers' lack of understanding in that area. And Michael, you're on the line, aren't you? Yeah.
Hi, yes, Deirdre, thank you. Thanks everyone for all your input. I've really enjoyed it, and you know that there's definitely progress being made in that area. And I was wondering, you know, I don't know if it's been asked in a different way, but see, and once disability leave has been accepted by the employer and is being utilised by the member of staff, is there still contacts required? You know how, like in terms of sickness absence, you would be having to speak to someone at intervals. You know, would that be included in the policy, like every 7 days or because some mental health issues, anxiety, depression, you know, schizophrenia, whatever it may be, there might be an issue with actually communicating or talking to the employer, or it could be detrimental doing so.
Yeah, absolutely. We'll come back on that in a second. I want to try and pull in Shan if we've got time. Go, Shan.
Hello, sorry. Excuse me, I've got children in the background, so I apologise for that. It's just we haven't got the disability leave policy. It is part of our healthy work environment. But the one thing that concerns me about it is when you read through it, it's all down to the discretion of the line manager, which to me means that our members aren't going to get the same experience. If it's down to the discretion of the line manager, as with everything, if you haven't got a good relationship with that line manager, you're going to be worse off. So I just think that that's something that would, if you are developing a policy, really needs to be addressed, that it isn't discretion and down to the individual line manager.
Yeah, no, brilliant point. And that exactly makes the point why we need disability leave. I'm going to hand back now to Toby, who wants to come in on some of those questions, and then we'll go back to Elizabeth.
Thank you, Deirdre. It was just to briefly make the point that with the recent change in working environments during the pandemic, a lot of employers are now considering the home as a place of work. And if you're now in a position whereby you're both home working and in the office at times, you need to make sure that your employer stipulates that in your contract and reviews your contract to make sure that you're not caught out by the wrong wording, but also that any reasonable adjustments and indeed disability leave is applicable in both settings. You're not just entitled to disability leave in the office if you're a home worker as well, whether that be ad hoc or regularly. So you need to make sure that when you're negotiating a policy, if that's what you're in the middle of doing, that you stipulate that there is a clause, a phrase, I don't know what you want to call it, that says that disability leave can be requested whether a disabled member is working from home or in the office.
Back to you, Chair, because I think we have done as much as we probably could in terms of answering the questions there. And I think, apologies.
I'm happy to unmute.
Yeah.
But there were, first of all, apologies that we didn't answer.
We're having no luck with Elizabeth's sound. I'm really sorry about that.
All the questions, and I just want to ask sports.
Right, I'm very sorry. We're having no luck with Elizabeth's sound there. So I'm going to mute her. I don't know if you can mute her on because she's coming in and out. So apologies. Elizabeth's really tried her best tonight. You know, she deserves a medal, but we've not been successful really. So yeah, just to say thank you to everyone for their questions, and I'm sorry that we didn't get to call everybody. I know there's a couple more in the chat who wanted to come in, but there was some, you know, good experiences there from people. And also I think, you know, some of you have outlined some of the barriers that you face, and it's kind of good for us all to get together and just realize that it's not necessarily a simple thing. You know, it isn't a simple thing. You've got to keep trying, and you've got to go back to the employer and keep making the arguments, as Toby was saying. It's not necessarily easy, but it's brilliant that I think, you know, people have come on this tonight, which obviously shows that you're committed to this. You know, you do really believe in trying to make a difference for disabled members in our branches. And that's, you know, that's the start. That's where you can make change happen if you're already committed in the way that you've proved you are by turning up tonight. So we will, this has been recorded, so we will put it on our website, technical glitches and all. We're not going to feel too bad about that tonight, and we'll also send out the slides to everybody who's attended as well. We will, I think a few people have said they could have done it more time, so we will look at seeing if we can run something again in the future, and if we can give people a little bit more time. So apologies if your question didn't get answered. Sounds like Elizabeth might be able to speak again. Do you want to try, Elizabeth, wrapping up?
Oh, I just simply wanted to say, if anybody can hear anything at all that I'm saying, a really big thank you to Sasha Robbins, who's taken time to write us quite a number of things that we will take on board in the committee. Because don't think that this is just it. Your participation here is much, much wider thing. And I do want to sort of give you a prompt for the networking days. Please, if you can go to those networking days, have a look on the website, have a look at that. The question about disability passports, just very quickly, disability passports is our thing. So we can't kind of make, we're talking about workplace policies really with this today. And Alexander, thank you so much. You've raised autism here, and the people who have raised neurodivergence, absolutely key. You know, this is how our committee is growing, by hearing what you need to be dealt with and looking at it. And it was brave and courageous to say to us, and quite right, that it's just really, it's not good enough. as far as we've gone. We need to go even further in doing our work. So we've taken it on board. Sorry about the backgrounds, but it's been great to be with you. Thanks for bearing with me.
Okay, thanks everyone, and we're going to close down the webinar.